All right, we'll continue our discussion of the reproductive system, looking at the female reproductive system and how it is compatible with the male reproductive system in producing the next generation of offspring. So when we look at the primary reproductive organs of the female, we're looking at the ovaries. So a woman has a pair of ovaries that are found in the lower pelvic cavity. If we look at their location, just above the bladder, near the location of the ileum. And there, like I said, there are a pair. We talked about these in lab, and the oviduct or fallopian tube or uterine tube is what carries that ovulated ovum to the uterus for implantation and for the fetus to grow. So when we look at the primary organs being the ovaries producing the egg, there's specific hormones that control that production, and we'll talk about that a little bit later. But in the ovaries are many ova or eggs, and these were produced initially during fetal development of the female. So this occurs before birth when a woman's ova are first produced, and there are millions of these eggs that are produced prior to birth. But then once the female is born, the number of eggs reduce significantly. So if you look at the 7 million that were produced during fetal development, that number goes down to about 2 million. And then during that baby, that young girl's life up through puberty, the number of eggs begin to break down as well, to the point of when a female reaches puberty, she has about 250,000 eggs remaining at puberty. That's still a lot of eggs. But once we look at the eggs that are actually ovulated, we're looking at about 500 over the lifetime of a girl. For example, if a girl has her first menstrual period at the age of 14 and then produces an egg every month until she becomes enters menopause at the age of 50, well, that period of about 36 years times 12 months out of a year, that's where they come up with that number of about 500 being available to be ovulated. So we're going to look at some of the events leading up to ovulation and the structures in the female that promote fertilization. So when we look at the process of ovulation, that is the process in which the ovary releases an egg. And that occurs once a month, usually about midway through the menstrual cycle. And that egg or ovum is separated from the rest of the tissue of the ovary by a layer of cells called the follicle. So the follicle is a layer around the ovum that nourishes and supports that developing egg in the uterus. And when that follicle ruptures, it releases the egg out of the ovary, off of the surface, and that egg is then swept into the fallopian tube by the fimbriae. And if you recall, the fimbriae were these finger-like extensions at the end of the oviduct that help to waft that ovulated egg into the fallopian tube where it will meet up with the sperm. So when we look at when women first enter puberty, it's usually for girls between the ages of 12 and 15 is most common, and that is the result of a hormone being released by the hypothalamus called gonadotropin releasing hormone, which acts on the anterior pituitary and causes the increase in secretion of FSH and LH, which then acts on the ovaries and stimulates puberty, which is essentially the development of an egg and those secondary sex characteristics we see as a result of estrogen secretion from the ovary. So this GnRH really begins the process of puberty. When a woman first enters into getting her menstrual period, that's when we say puberty officially begins, when she first menstruates. But that menstrual cycle being 28 days long, bleeding is considered day 1 and ovulation is at day 14. So by the time a woman has her first menstrual period, she has already ovulated, which means that she's produced an egg, it was not fertilized, and then the menstrual period began 2 weeks after that. And we'll look at the menstrual cycle here in the notes in just a bit. But it's important for people to recognize that a young girl can become pregnant prior to her first menstrual period because ovulation occurs prior to menstruation. And when a girl does begin to menstruate, what we have found is it takes about 3 years for the hormones to consistently rise and fall to trigger ovulation and the menstrual flow. So girls that first begin to menstruate find that they have irregular periods, unpredictable periods. Sometimes they skip a period, and that's normal. Oftentimes people become concerned about that, and they'll put a young girl on a birth control pill to regulate her cycle, when actually it takes almost up to 3 years for that cycle to regulate on its own. So we should be careful about prematurely putting girls that are not sexually active on birth control, because there's side effects with birth control pills that it's not ideal to place a young girl on birth control if there's no real need for it. So the menstrual cycle is about 28 days long. The first phase begins with bleeding, which we call the menses, and then we have the proliferative phase where the uterus builds up in thickness, and then the secretory phase where the uterus is preparing to have a fertilized egg implant, and then it finishes with the beginning of the next cycle with bleeding again. So when we use the term the menses, we're referring to the bleeding that occurs with menstruation as that endometrial layer of the uterus is shed. Amenorrhoea is a term that we see or that we use when we're discussing a woman that has stopped menstruating. Now that could be due to excess exercise, not necessarily excess, but a lot of exercise, which causes a woman to have less fat on her body. And we know that estrogen does that fat cells do contain estrogen and secrete estrogen. So as a woman's fat content of her body goes down, sometimes we see missed menstrual periods. That's called amenorrhea. And that would be a temporary situation. But when the ovaries can discontinue releasing estrogen and progesterone, that we call menopause. And that can occur as early as the late 30s for some women, but most commonly it occurs in the early to mid 50s when the menstrual cycle stops and the ovaries no longer produce progesterone and estrogen. So if we look at some of the other structures of the female reproductive system, the breasts are the organs for producing milk to nourish the newborn. So we talked about these in lab, that the alveolar glands are responsible for producing the milk with the action of prolactin, a hormone that acts on the alveolar glands, stimulating milk production. And that milk is carried to the nipple by the lactiferous ducts. And this process begins about 2 to 3 days after birth, when women can actively create breast milk and nourish their newborn. Prior to that, the breasts, right after birth, when a newborn is breastfeeding, the breasts release a small amount of a yellow watery secretion called colostrum, and that contains lots of antibodies, a little bit of protein. It's a very rich source of nutrition and antibodies, but it's a small amount, so babies tend to lose weight in those early days after birth. But once the mother's alveolar glands start to produce milk actively, then babies gain that weight back quickly. So the menstrual cycle, as we look at it from beginning to end, the menstrual cycle lasts 28 days on average. So that means there's 28 days that passes from one bleeding episode to the next bleeding episode of the menstrual cycle. So day 1 begins with menstrual flow. So when red blood starts to flow out of the vaginal canal, that is the first day of the menstrual period. And that bleeding lasts for about 5 to 6 days, tapering off during that time. And then the endometrial lining, the uterine lining, starts to thicken and prepare for the next cycle where the fertilized egg would implant. So here we see a thickening of the endometrium, and at day 14 in the ovary is when one of those eggs is selected and begins to enlarge, the follicles around it enlarge and nourish that egg, that ovum, until it is ovulated. So ovulation occurs at day 14. So the bleeding is at day 1, ovulation at day 14, and what triggers ovulation is an increase in LH from the anterior pituitary gland. Some women use ovulation test kits at around mid-cycle, about 2 weeks after their menstrual flow, to detect this LH surge so they can better time intercourse. Because once that egg is ovulated, that egg is only viable for about 24 hours. So the timing of intercourse is very important to make sure that intercourse occurs close to when that egg is viable and able to be fertilized. So if fertilization does not occur, that endometrial lining, as it nears the end of the cycle, day 28, hormone levels fall, estrogen and progesterone, and again that leads to the start of the next menstrual cycle, beginning with day 1 with menstrual bleeding. So we can see hormone levels are rising here, particularly progesterone is what plays a large role in the thickening endometrium, and if fertilization doesn't take place, that hormone level falls off, and again the endometrial lining is shed. So it's important to look in terms of hormone levels at the beginning of the menstrual cycle. Hormone levels for progesterone and estrogen are low, and for some women that causes some system-wide effects. Some people feel a little more anxious, maybe a little more depressed, a little more irritable when those hormone levels are low. Some people experience a little bit of weight gain due to water retention. Some people have cravings. Some people have headaches. Some people have insomnia as a result of these low hormone levels. So good things to do around this time of the month is to exercise, make sure we're eating right and getting proper sleep, because that will help kind of counteract some of those negative side effects of low hormone levels. So when you compare the sex act of females to males, they're quite similar in the sense that there's parasympathetic stimulation that leads to the early arousal period, and blood flows into the spongy tissue or the corpora cavernosum tissue of the clitoris, just like it does in the male penis. So that's a very similar process. And also around the vaginal opening becomes swollen during the early arousal period when the parasympathetic neurons are stimulated. The nipples become erect, and the fluid in the vaginal canal, we see more fluid in the vaginal canal, which will allow for easier insertion of the penis for intercourse. So it plays a role in promoting intercourse and making that pleasurable for the female. And for orgasm then, the sympathetic nervous system also is what contributes to orgasm for the female. So that, just like in the male, is important for those for orgasm, and the parasympathetic nervous system switches to sympathetic output to the organs to achieve orgasm. Of course, orgasm isn't necessary for fertilization as it is in the male. So the sexual behavior of females depends on those androgens that are produced from the adrenal cortex. Those are male-like hormones, testosterone, that do play a role in sex drive for women, and also the balance of estrogen and progesterone also plays a role in sex drive. Women find that right around ovulation is when they might have an increased sex drive because of the hormones the balance of hormones at ovulation promote intercourse and the feelings to participate in intercourse. And of course, psychological factors play a role for both male and female, where stress or anger or fear can definitely interfere with parasympathetic stimulation and dominance, which can prevent arousal from occurring and can prevent orgasm. So if we look at what promotes fertility in females, the timing of intercourse is vital, because that egg only lives 24 hours. But sperm can live in the female reproductive tract for up to 6 days. So that allows a little more time variability for intercourse to occur depending on when ovulation occurs. So if intercourse occurs after 24 hours after ovulation, then fertilization is very unlikely. However, if intercourse occurs prior to ovulation, it can occur up to 6 days prior to ovulation, then fertilization is possible. So for couples trying to plan, families, it's important to know these numbers, that intercourse is best to occur before ovulation. So that's when Like I said, a woman might use an ovulation test kit to determine, when she's going to ovulate, so she knows when that egg will be available for fertilization, and then they can plan intercourse on either side of that. So fertilization occurs here in the uterine tube. Very important to know that's where fertilization. So these sperm have to travel up the vaginal canal, through the cervical canal, through the uterus, up the fallopian tube to find that egg in the fallopian tube. And then it takes time for that fertilized egg to come back down the fallopian tube and implant in the uterus. So from the time a couple has intercourse to the time that she might see a positive pregnancy test using a urine test kit can take up to 2 weeks, because it takes time for that fertilized egg to make its way down to the uterus, and it takes time for that implanted embryo to start to release the hormone HCG to be detected in the urine or a blood test. So HCG stands for human chorionic gonadotropin, and it increases in the first trimester. And this is when women are testing to see if they are pregnant, and it depends on that embryo implanting in the uterus. So until that happens, HCG will not be detected. But once it's detected, it is a very positive indicator for pregnancy. There can be false negatives. People can test too soon, where there's not enough HCG present in the blood and then in the urine to be picked up on a pregnancy test. So it's important for women that think they might be pregnant to test more than once if they don't get their menstrual period at the regular, predicted time. And some of the most sensitive pregnancy tests are available actually at the dollar store. They detect a low level of HCG in the urine. So they're very sensitive tests and very reasonably priced. It's just a matter of making sure you know what a positive test looks like. I think some have blue 2 lines versus 1 line. 2 lines if a person is pregnant, 1 line if they're not pregnant. And a faint second line is an indicator of pregnancy. It doesn't mean that it's a false test. It just means that only a little bit of HCG was detected. And even if a little bit is detected, that's a good indicator of pregnancy. Not all pregnancies are viable, though. Not all pregnancies result in a baby. Sometimes there can be some HCG secretion as an embryo is implanting, but there's not enough information either in the egg or the sperm to actually produce a baby, and it no longer grows, and the menstrual period comes right on time, and the HCG levels drop. And that's an indication of a chemical pregnancy, which means there was a pregnancy that occurred, but it didn't last long enough to cause a missed period, and the HCG levels decline quickly shortly after they were detected. This is just a little animation about childbirth. You can watch that on your own. It's nothing really spectacular, just kind of a neat little video. So I'm not going to go into the details of birth control. Just a couple of things to mention is that breastfeeding suppresses ovulation in some women, but some women it doesn't last very long. Some women will get their menstrual period as soon as 6 weeks after having a baby, and they can become pregnant again. And other women, if they breastfeed, they stop breastfeeding when baby gets to about 6 months to a year, they don't ovulate until after they stop breastfeeding. So for some women, breastfeeding can suppress ovulation and prevent pregnancy. But it's not something that someone would certainly rely on, because again, we always ovulate. Women always ovulate prior to their menstrual period. So if a person waits for the menstrual period, they've already ovulated, and if they're sexually active, they could be pregnant. Oral contraceptives are very low-dose hormone pills now. So if a woman misses her dose of a pill, she can have some breakthrough bleeding. So it's important that women be aware that if they miss taking one of their oral birth control pills, that they are at risk for pregnancy, and there can be some breakthrough bleeding because of that missed pill, and it might take a while to get those hormone levels back on track to stop that breakthrough bleeding and be back on track with the cycle. Vasectomy and tubal ligation we talked about in lab. This is highly effective. It just cuts the vas deferens, or the tube leading from the testes to the glands that secrete semen, and that is a very effective form of birth control for couples that already have children, because it's considered permanent. Tubal ligation is cutting the fallopian tube, same type of concept, so it cannot carry the egg to the uterus. So those are two very common procedures used among committed couples that already have a few children. Some of these others, you can look at those on your own. I'm not going to go into the details. The Depo Provera shot is an effective method of birth control for people that are not planning a pregnancy for a long time, because some women have found that once they stop using Depo Provera, it can take up to a year for their periods to return. So this is a good method for people that aren't good at remembering to take their birth control pills, but maybe aren't planning pregnancy in the near future. So as we age, what happens is the size of the testes decreases, and as a result of that, testosterone production goes down. There's a decrease in sexual activity, decrease in sperm production, but keeping in mind that men can produce sperm throughout their life, but there's just less sperm production as they age. The prostate gland enlarges, and we see increases in prostate cancer in men as they age, particularly over the age of 60 to 70. And impotence is the inability to achieve erection and ejaculation. That tends to increase as men age, but typically it's not until they're much older, over the age of 75, that can really become a concern, depending on other factors as well. Sometimes it can set in a little earlier, depending on the medications a person might be taking. For women, menopause sets in between the ages of 50, 55. With those declining hormones, we see a decrease in the size of the reproductive organs, and the vaginal secretions become very dry, making intercourse more uncomfortable. So a lot of women will use, some of the creams, over-the-counter creams, to help moisten the vaginal wall for intercourse. And we see an increase in cancers, breast cancer, uterine cancer, and ovarian cancer as women age. So it's important that women really pay attention to changes, that might be occurring. Any bleeding that might occur after menopause, would be something that should definitely be examined. Any pain, making sure they're doing those annual breast exams. Very important to watch out for those cancers. So that concludes our discussion of the reproductive system.